We have tonight part one of a part two series. So we're going to kick off by talking through the versatility of a carboxytherapy gel, also known as CO2Lift and CO2Lift Pro. We have two amazing panelists here tonight, the lovely and amazing Dr. Shamban. So Dr. Shamban is an expert dermatologist from practicing in Beverly Hills, California, known worldwide, celebrity dermatologist, board certified. So thank you very much for joining us, Dr. Shamban.
Of course.
We also have Lana Kerr, who is our CEO and founder. So two amazing experts on our panel tonight. And this is going to be just kind of fun, interactive Q&A session. So we're going to be kicking it off here with a video that Dr. Shamban had put together previously, just talking about one of her beauty secrets.
Now we're going to talk about masks. So this CO2Lift mask is my favorite. We apply it right after procedures, and we apply it to every body part. And you're going to see that your skin's going to be so hydrated and glowy and dewy.
Is this the mask that Chrissy Teigen loves?
This is the mask that Chrissy Teigen loves.
She looked crazy on.
Yes, that she looked crazy on. It does look a little bit like a horror movie. It plumps up the fine lines and wrinkles. It's not a permanent treatment, but it really plumps everything up. So that's why it's so popular with all of the actresses before they go on the red carpet.
Lovely.
Okay, so we definitely have some celebrity clout there, right, Dr. Shamban?
Yes. Yes, I think it's very interesting. So we're going to hop right into the science of this. Well, it is kind of a device because it is a mask and it does do something very interesting for the skin. And I think that all of us who do really any procedure involving the face, whether it's a tissue tightening or whether it's a laser that's actually even a fully ablative laser or a fractionated laser, as well as something like a clear and brilliant or an intense pulse light. And so anyone who's had one of these treatments or who uses it in their office knows that people can have delayed healing times, and they can also experience some kind of later side effects such as redness and even some mild scarring. And so oftentimes in the past, what I would do, and still sometimes, is we would send people for hyperbaric oxygen. So because we know when you increase the oxygen content of the skin, then you are going to get some vasodilation, and then you're also going to get, because of that vasodilation, you get delivery of more growth factors and other cytokines that will help encourage healing and reduce inflammation as well. So I was introduced to this carboxy mask actually probably about, I don't know, 6 or 7 years ago, but I didn't really take it on that quickly because I was like, oh, well, sounds interesting. It takes 45 minutes. I'm not sure what it's going to do. But I did an event and with a group of women and started to use it just on its own. And I noticed dramatically that even with not applying this mask after a procedure, just on sort of, cleansed skin, that the skin looked so much more hydrated and a little bit plumper following the 45-minute treatment. And then I knew about some of the science, which we're going to go into, right? And also some of the before and afters, that it seemed it had an effect. And so, but I'm not from Missouri, but I'm kind of like, okay, so show me and I'll believe you. So, but here's some of the science behind it. So there's an article written in 1987 that in fact it does increase, not tisular, but it does increase tissue oxygenation. And the reason for that, we're going to go into that. Also, there have been several articles published, and here there are the citations, and and this work goes back actually almost 20 years. So it's been around for a long time. It does increase flow rate and vasodilatation. In fact, it looks like there's some sort of upregulation of different enzymes in the extracellular matrix, which does improve the overall quality of the skin. There's some evidence of biostimulation of the fibroblasts, which then increases remodeling of the connective tissue. This was in JDD back in '08. And in addition, and this is probably because of the vasodilation, it does help restore microvascular unit exchanges just by the vasodilation. It's really primarily works through vasodilation, increased delivery of growth factors, as I said at the beginning. So go to the next slide, and I can continue. So how does it work? So the way it works is by delivering CO2 into the skin. So we have other ways of delivering CO2 in the skin, but those are invasive. Those are injecting it. And we also see some of the same effects. But of course, with injections, comes risk, it hurts, bruising, etc. But when you increase the content of the CO2 in the skin, then you reduce the pH. So this is the Bohr effect. So when the pH is lower, then what happens is the oxygen pops off of the hemoglobin. So it causes this so-called right shift in the curves. So you can see with these increasing amounts of pressurized CO2 that you get a higher level of oxygen, and that's all just due to the O2 popping off of the hemoglobin. So this is the basis of how it works. You apply the mask, increases the CO2 content. So when you have the oxygen, then it does help stimulate cell division and helps so-called activate the cells. I mean, to me, it doesn't really directly activate the cells. What it's really doing is increasing the delivery, as I said, of growth factors. And I know I've said it 100 times, but that's just in case you weren't really listening. Anyway, so the CO2 gets into the skin, the capillaries expand, and actually dilate because of the decreased pH. And then with more blood flow, with increased blood flow, you get more oxygen delivery, and also not only the cytokines, but you get nutrients as well. So it acts at different levels. And all through, it's always nice in medicine when you have a fairly elegant sequence of events. It's very simple and not complicated, but the effects are quite profound, and it's very interesting. And so I found this mask to be quite useful in my practice. And you can see what.
One of the questions, sorry to interrupt you, Dr. Shamban, that one of the attendees had asked prior to was like, what would be the simplest way to explain? And I know you just did a really great explanation, but like the quick way that you're explaining the CO2 lift and presenting the value and presenting that quick science to your patients.
So the quickest way to explain it is that this is a topical hyperbaric oxygen treatment. So that's how I explain it. It's a way to increase oxygen content in the skin without having to go into a chamber or have a so-called, and even if you apply oxygen to the top of the skin, it's not getting in there. You've got to be able to have a system to deliver it. So I call it a topical hyperbaric oxygen treatment.
I love that. And Lana, I know when Dr. Liebeshoff came up to you at one of the meetings, when we first got started here presenting this to other physicians, he kind of called your bluff, and he said that, there's no way that this can be true carboxytherapy. So you want to talk through a little bit the first clinical study that was completed?
Yeah. Well, they call him the father of carboxytherapy. He's been using carboxytherapy in his practice and lecturing on carboxytherapy for 40 years. So when he was at that meeting, and it was actually Dr. Roberts was talking about the gel carboxy, he felt that was impossible because he's used to the delivery method with through injections. So we said, okay, why don't you take it and compare it? And so he used a video capillaroscopy machine and measured what was going on underneath the skin. And he saw that the same actions were taking place. The capillaries dilated in the same way, except that, of course, with a gel, just more versatile. So he was convinced, and at that point that he really jumped on board. So we were excited for him to get the results that we had expected to get.
I remember Dr. Shamban, you said something once. You said it's too good to be true, but that's not even true because it is true because of all the sciences behind it. So it's just good.
Yeah, and it is. I saw in the chat that there was a question about, is this like nitro paste? It's very interesting because nitro paste, what we've learned is that nitro paste actually is a venodilator. It it dilates the venules, the tiny little veins or the veins, but it doesn't affect the arteries, and this affects the arteries. So, and which you can see, I mean, I think this is the most telling example here. So people who have microvascular disease, which people with chronic long-term type 2 diabetes have. So remember, all their tiny capillaries are compromised now. They can be filled with plaque, they can be closed down. And so that's how, and also people with diabetes get neuropathy. So they lose sensation peripherally in their feet. And so they're much more prone for both of those reasons to develop these ulcerations. So how do you get them to heal? So typically, I mean, there's some of these very expensive specialized dressings, and people will go to hyperbaric oxygen. They'll go into these whirlpools. They'll have grafts put on. But it turns out, which is actually kind of incredible, that you can heal a lot of these ulcers using this carboxy mask. So you can see here on the left, this patient on her toes, obviously the further away from the heart, the less blood flow. She had 3 CO2Lift Pro treatments. So those are the CO2Lift that we have available in the office. 3 per week for 4 weeks. And look how nicely those wounds healed. And you can tell they've been chronic because you can see the heaped up sides. They're not infected. It's a clean wound. And then on the right-hand side, and this, of course, is an extremely thick epidermis here, the thickest of anywhere on the body. And this also, these were 12 treatments as well, and that healed very nicely. So it's pretty impressive. So when you see this kind of results in compromised vasculature, then you're like, oh, well, hey, maybe there's something to this.
I love that. I love hearing your expert dermatologic take on it. And with that being said, too, I know a lot of people have talked about using it post Mohs. I don't know if we've really gotten a lot of case studies on that just yet, but talk to us about how you feel this could work with Mohs surgery.
So really, when we're talking about undermining the skin around the defect that's produced by removing the skin cancer, then obviously if you're undermining, you're going to compromise some of the vasculature. So the face has 1,000 different ways, more than 1,000, to restore blood flow to the area. And that's why in general, the face heals well. However, that being said, I mean, this is a younger person, but in an older person, they might need more help. And also in a younger person, what you're really fighting with is inflammation, which can happen following trauma to the skin. So applying the carboxy mask you can actually do it before the sutures are taken out, but immediately after, you're going to, once again, hyperbaric oxygen. So you're going to get better delivery of cytokines, which will both help with the heat, help reduce inflammation, as well as stimulate the fibroblasts to make more collagen. And so theoretically, you can get a better result following as the scar heals. But we're going to see some more dramatic results of this in a little bit.
Yeah. And Lana, you were just in Japan at the manufacturing facility. So the product CO2Lift is manufactured in Japan. And talk to us about the sterility of the product and the ability to be able to put it on top of an open wound and on top of sutures.
Yeah, it's produced in a sterile facility. You saw some of the pictures, complete covering, everything is locked off, so that you can apply it. And many surgeons are using immediately post-surgery. So it is a sterile product.
Great. Awesome. Okay. Thank you. So with that being said, that we have a couple other post-surgery cases, and I know part 2, we're going to go a little bit more in depth as to these surgical cases, but this to me is a little bit more of just a skin issue with the blistering from the tape. Do you want to, let's have your take on this, Dr. Shamban.
So once again, when you disrupt the skin, and in this case, this woman suffered a fairly superficial injury from taping of the post-mass reduction treatment, then and also in an area that has had a more invasive procedure as a mammoplasty has, then you don't want any kind of raw wound to be there unattended to. So it's very interesting to be able to use something like the CO2 lift to be able to stimulate, to accelerate the healing, I should say, accelerate the healing.
Great. And I've gotten the question a lot too on like, how effective is this on radiated tissue? Do you feel like this is an effective treatment, effective way to treat radiated tissue?
So I have not, I don't see people with radiation dermatitis. I've actually never seen anyone with it, but reports have been made that once again, the radiation, what's it going to compromise? It's going to be picked up by some of the tiny little arterioles. And so when they're gone, and then also the inflammation created from the radiation, both of those can be addressed using something simple like a Carboxy Pro lift. And so if you look here, you can see how the discoloration of the skin is significantly improved, even by day 3. So that's just two applications of the mask, the CO2 lift mask, and it's quite dramatically improved. And also, I do know, I mean, it's not like I've never seen anybody post radiation therapy, but it's angry. It's as uncomfortable as it looks like it would be. It's not like just sitting there like, oh, it's kind of red brown and it's not a problem. It's actually extremely uncomfortable. It can be painful, at the very least burning. And so this mask is extremely soothing to the area.
Talk through like the temperature and the like the sensation that you get when you apply the CO2 lift.
Yeah, it's cooling. It's a very cooling mask. It's very nice. And what's also interesting, so in cases where people have a compromised skin barrier, in this case, it's a skin condition, obviously, atopic dermatitis. I'm just sort of addressing this to a broader audience here. So atopic eczema or atopic dermatitis, also both are the same, or different names for the same condition, do develop dryness, a lot of itchiness, a lot of inflammation, and the skin becomes so dry that it cracks like a piece of dried, dried wood or something. It just cracks very easily. And so to treat it, you want to be able to reduce the inflammation as well as increase the hydration of the skin. And so this gentleman had, I don't know if this was one application or 2 applications, but you can see 4 days after, I imagine it's a single application, you can see the diminishment of the redness as well as the healing of some of these fissures. And you can see in the top slide, the before, how there's, right where your pointer was, there's kind of this scaly, like a little bit of scaly white skin right next to these little fissures, as well as you can see the scratch marks closer to the wrist on the red area, and the what's called lichenification, which is where the skin markings are increased, and you can appreciate that the skin is slightly thickened. All response of the tissue to this condition, to this dermatologic condition. So then as you go down to the bottom, you can see that scaly area right in the middle, that's gone, perhaps because he stopped rubbing, because the itching was so much more improved. And the redness has completely shrunk, but the lichenification, the thickening, you can see the exaggeration of the skin lines dramatically improved.
Yeah. Here's another case too.
Yeah. So once again, this is a difficult area to treat around the eye because you're concerned. You don't really want to use steroid there because that can give cataracts, and using one of the non-steroidal treatments, which is not, that can wick into the eye. So this is a perfect place to use it. You just have the patient obviously close their eyes when it's being applied, and then they need to have someone help get it off at the end. Well, I guess they can take it off themselves, but certainly putting it on, you need a little help getting the eye area. But yeah, much, much better. I'm not sure what the time interval is between these two.
This one's
pictures.
immediately after according to the client, to the
Oh,
account.
okay. All right. Very interesting.
Lauren, some questions are on, maybe you want to just address, or do you want to wait till the end?
I was just going to
No.
say, we have a couple of little questions in here too. So,
Yeah, I'm looking at the chat too, Lauren. So yeah, it's good to address them along the way. Can you apply the mask to open skin wounds after microneedling and acne extractions? And the answer is yes, because any of the bleeding from microneedling, this will seal it in, so you get kind of a mini vampire face treatment. So that would be yes. And then to Cassandra, you're not going to leave it under over a few days. You're really going to leave it on for about 60 minutes. It's not like nitro paste. It's totally unrelated. Nitro paste, the only thing it does is it dilates veins. It doesn't increase hydration of the skin. You're going to see in some of the other studies that have been done, it's not at all like nitro paste. The idea of it being a vasodilator, yes, but anything else beyond is very different.
And I know Dr. Hoyos in our part 2 will talk through this, that he has been leaving it on a little bit longer and sealing it with just like a plastic film. So it can be done, but
right? Just because of convenience, right, Lauren?
Right, correct. Yeah, yeah, exactly. One more question from Cassandra. We would want it on a compromised skin and surgery or nipple areola complex under a tegaderm. Sorry, I'm not sure if I'm saying that correctly.
You are saying it correctly. Yeah, that's interesting. That's interesting. So you said Dr. Hoyos is leaving it on for a very long period of time. I just don't know how long it's still delivering CO2 to the skin. It's not that it would harm anything. It's just I don't know if it would make it more efficacious to leave it on longer.
Dr. Shamban, he's just doing it because of his process. When he puts it on post-surgery, he just wants for them to go home. So he just leaves them on with it until they come back. So it's not hurting, but the delivery of CO2 stops after 60 minutes.
Yeah. So yeah, it's not going to hurt anything.
Yeah. More convenient with the dressing.
More convenient. So here, looking at these psoriatic patients. So on the left side, you can see kind of the classic, almost like a nummular eczema here, but it does look like psoriasis. And extremely itchy once again. And here it's on, I don't know if it's on the left, I don't know if it's on the wrist, or maybe it's part of the arm there. It's the same as on the right. And so once again, I mean, it's so fascinating about how you can improve the biology of the skin by using something as simple as this mask. Simple and elegant. Look how healed. Yeah, go ahead, Lauren.
Oh, sorry. A lot of people comment, and I know skin microbiome is a big buzzword too. Do you want to comment a little bit on that and how it can affect the microbiome, or does it not affect it at all?
Well, I mean, it's all speculation. It's not that we know for sure what it does to the microbiome, but we do know that the population of the microbiome varies from area to area of the body, depending on the local conditions. So if you can imagine that under the arms, it's like a rainforest. Whereas if you're on the tip of the knee, it's probably like the desert. So you're going to have a different population. So by using the mask, it probably does affect the population of the microbiome. And so there's so many factors at work here as to how it possibly could be efficacious. And some of them we understand, and some of them we just don't know. But it's all good. That we do know.
Mm-hmm. And rosacea, I know a lot of people have asked me why would this work if you're bringing blood flow, that would it not flare up rosacea or cause the rosacea to worsen?
Yeah, it's very interesting. It does seem to act like it normalizes the skin, in some way, probably because rosacea is highly inflammatory. So we know that it's going to reduce inflammation, because we've seen how efficacious it is in atopic dermatitis as well as psoriasis. So that's probably, if I had to guess at a mechanism of action, that's what I would land on. And Lauren, which you can see here. Yeah.
Sorry, go ahead. I was thinking in the picture before, Lauren, you can see even after the second treatment. So it has an exponential improvement in the skin. So after her first treatment with the CO2 lift, and you can see the second one, which was done the following week, you can see continue to improve. So it didn't go back to baseline.
Yeah. Let me go to a couple questions in the chat too. So
Okay.
one question is, can this be done over microneedling with exosomes? And so this is that would be an excellent use of this mask, because that's going to help drive the exosomes into those tiny little microchannels that you've created with the microneedling, because you're applying, instead of something like saran wrap or something, you're applying more of a dressing that's going to help that process. So it's going to increase, as I said, the vasculature, and but you don't increase. We've used it quite a bit with exactly this way with microneedling and exosomes, and you don't increase bleeding with it or anything, but you do increase the result. Is it beneficial for pitted atrophic scarring post-acne? You'd have to do something to the pitted atrophic scarring. So you would either do using a toothpick, using some TCA in those scars, or doing some sort of a fractionated laser. And lastly, for Juliana, is this helpful for rosacea? Yes, it's helpful. Could it replace IPL? Well, we really like our IPL too, so I would do it after an IPL. And then I'll just do one more anonymous, and then we can go back to the meeting. So in an aesthetic setting, which is outside of a doctor's office, would you use this in collaboration with hydrofacial? So in the treatment, it would go on at the very end, after you have all the serums and what have you applied to the skin. It wouldn't go on in the middle. It would go on in the very end. And what's nice about it is you can apply it in the office, and then the patient can leave as long as they can see if they're driving. But yes, it could absolutely be applied, and then the patient can leave with it. And post peel, I would wait until the patient is as long as when the peel starts to come off, when the skin is sort of fresh and red, it's a great time to put it on. Okay, so this patient, once again, this is a patient who has rosacea, and you see the improvement in the young woman prior to this slide. You see the dramatic improvement over time, and you can see that with this rosacea, there's a little bit of melasma, or just sort of some mottled brown, which has to do with inflammation, because we know that the melanocyte system is involved in reducing inflammation. So you can see it's very interesting that it looks even a little bit better in the last photo here.
Mm-hmm. And so someone had asked what would be the recommended protocol for rosacea?
So that's a good question. I mean, I would suggest 3 treatments for a week for the first 2 weeks, and then maybe drop it down to 2, and then maintenance would be once a week, along with the topical prescriptions, or even we've had very good results with some of the over-the-counter cosmeceuticals, some cosmeceuticals for rosacea.
And then does it need to be prepped at all before doing this for rosacea? Do you have to prep the skin at all?
No. Mm-mm. Just take off any makeup. Yeah.
Okay. And so someone had asked also using it in combination with LED. I feel like I've gotten some different responses. Some say that they like it with LED on top. Some say that the LED might not be able to penetrate through the gel. So do you have any takes on that with using it in combo with LED?
Yeah, I mean, there's no reason not to. Yeah, I mean, it would help.
Perfect. Okay. I think someone had just actually asked about vascular occlusion. So I believe you're familiar with Dr. Persick. So I'm going to play this quick video from Dr. Persick. We took this at the Cosmetic Boot Camp in Aspen this past summer. So she came up to us and just wanted to share a story about a vascular occlusion case that she had.
Hello everyone, my name is Ava Shamban. I'm a plastic surgeon at the University of Pennsylvania, and I'd like to share with you my experience with a carboxy gel. I had a patient who came to me with a vascular occlusion injury secondary to a filler to the face. She was treated successfully, and the region that had some delayed healing with bruising and requirement of oxygen, I encouraged her to use the carboxy gel treatment, which she ordered on her own. We don't even carry it in our practice, although I'd love to. However, she ordered it, and she had a significant improvement in the oxygenation of her skin, so much so that she has completely healed from the vascular injury, and the patient herself is now continuing to purchase the treatments, the Carboxy gel treatments, on her own, and she's had a full recovery, and I think this really significantly improved her recovery.
So what's your take on using this for vascular occlusions, Dr. Shamban?
So vascular occlusion it has a lot of different parts to it. And depending where it is in the face, there's a whole, it's a true dermatologic or surgical, it's a true emergency. So using the mask on its own for vascular occlusion is inappropriate. You need to dissolve the filler in the whole region. You need to there's different, I'm not going to recommend a protocol because I want to say, oh, Dr. Shamban said to do this and this and this. I will tell you this. So we do multiple things if there's a vascular occlusion, but it includes the mask. And so because vascular occlusions, a lot of times, if they happen right away and you dissolve it, then you really have no tissue compromise. But let's say it sort of evolves over like a few hours and even overnight in one of your patients, and they come in the next day or a couple of days later. A vascular occlusion can cause vasospasm of an adjoining branch of one of the arteries. And so that's not going to go away with the carboxy. That actually mysteriously seems to respond to injecting one of the hyaluronidase, either Vitrase or Hylenex. So they can, for some reason, the spasm goes away with that. But we have had not that many, I mean, recently in the last 5 years, just one nasolabial vascular occlusion. And the patient she didn't come in for 48 hours because for some reason she thought it was okay to be in that much pain. But when she did come in and we started treating her with a carboxy mask, she loved it because it made her skin look so great. And the area did necrose a little bit, and then it healed with the carboxy mask, so there's not a mark on her. But yes, it's one of the things you want to have available for a vascular occlusion, but it's not a standalone thing.
Right, not a one-trick pony. I know a couple of people said that it's in their kit, it's in their VO kit. I think Dr. Chillicuri has talked about some of the cases that he's had for vascular occlusions that have come to him where it's helped as well. So, and then just like in general with Botox and fillers, is there any reason to wait after any of your injectables to do a CO2 lift? Is it going to help with bruising and swelling and speed up results?
Yeah, so there's zero reason to wait any period of time following a CO2 lift. I mean, following an injectable. We're just talking about an uncomplicated injectable of either a toxin or a filler. There's absolutely no reason to wait. You put it right on the patient. And the patient, as I said, they can go straight home. And it's a really nice way to improve the skin quality. Because I think I'm all about, like, if you do something one day and you give the skin a little bit of time to adjust and accommodate. So if you're injecting toxin and filler, then you'd want to, in the next, maybe, and you send them home with a mask, and like 2 or 3 days later, you do another mask, and their skin is going to look amazing. And they'll be more interested to come in and have another treatment.
Dr. Shamban, I've heard Dr. Lupo, I know that she's your friend, speak about using it, especially with lip filler. She loves it with lip filler. She feels that it helped to prevent the swelling. Anything on that?
Yeah, I completely agree, because swelling is a response to trauma, which would increase inflammatory cytokines. So this is going to reduce those because it's going to change the balance of what's being released. So yeah, that would be great and you can put it on top of the lips. There's no reason not to. It's a soft jelly-like feel to it, or when it's on.
Yeah. Thank you.
And I know I kind of love that Skin Vive is out now, because it talks about the importance of hydration, and we had done one of our original studies on hydration showing the increase in hydration immediately. And then you co-authored this paper with Dr. Zoe Dralos talking about just as a monotherapy, with 6 treatments within 1 month. So 6 masks, 3 in the first week. You want to just kind of talk through some of these results here, Dr. Shamban, that were reported and published in the paper?
Yeah, so what was very interesting was I had suggested to the company that it was time to do some kind of a paper to look at the basic parameters about the skin following the use of the mask. So looking at transepidermal water loss, looking at reduction in appearance of fine lines and wrinkles, and looking at elasticity, or which is the snapback quality of the skin. So you just thought, well, we're just going to kind of look at these sort of standard evaluations of the skin and see how it improved with the mask or not, or see if it didn't improve. You're always, you never know what kind of data you're going to get. So what was really surprising, with relatively few treatments with the mask, and these patients all were just using a very simple soap and some Cetaphil facial moisturizer and Cetaphil sunscreen, that what was super interesting was how much improvement you saw even at week 4, and it continued, and the improvement continued at week 10. And so it really carried out after you stopped using the mask. And it wasn't that many treatments, really, if you look at it. So, but when you look at all of the other parameters that were measured, you can see the increase in luminosity and radiance, the decrease in tissue sagging and pigmentation, also obviously fine lines and wrinkles. So, I mean, 24%, 20%, this is real improvement. The same with the sagging, and also the improvement in the pigmentation. Basically, the skin doesn't like to look nasty. It wants to look its best. So it doesn't want to have fine lines, wrinkles, brown spots. It doesn't want to sag. It wants to be glowy, and it wants to have nice elastic properties, which means if you pick up the skin, it's going to snap back to the original state. So it was remarkable how much improvement we saw in these patients with a fairly low number of masks. So, I mean, is it the microbiome? Maybe. Is it what is increasing delivery of O2 to the skin due to the whole physiology of the skin? Well, it looks like it's all thumbs up all around.
I love it. Yeah. And so just a couple of case studies, and it's interesting because I think because of that study, we now just for faster results, we say, go ahead and do those first 3 treatments within the first week. Whereas historically, Lana, if you want to comment on this, we used to recommend just 1 a week because you wanted to get that loading dose in within the first 7 days.
Yeah. Before we used to, when we did our study on hydration, where it showed that after the first 3, after the first one, hydration increased to 117% in the skin. And then after 3, then it maintained it, and then it was monthly to maintain it. But after this study that Dr. Shamban, Dr. Draelos completed, we just saw such a big improvement by doing loading up with 3 in the first week, and patients and love the results of that. So that's what we're recommending: 3 in the first week, 2 the following week, 1, and then just monthly to maintain.
Great, awesome.
So before we talk about this picture, I'd like to go back to the Q&A. So one attendee asked if you could apply benzoyl peroxide right after removing the mask. And so the answer is yes, but the lowest strength available, because you're going to get more absorption because the skin is so hydrated and all of the pores are open. So you're going to get more absorption. So you could, if you're pressed for time, but otherwise you would have to wait till, a few hours later or something. And it will not help syringoma. It's a benign growth deeper into the skin. And no, this is absolutely not going to do anything. So
great. I know we're going to get into some post laser applications as well here in a little bit. So hopefully we'll be answering, and we can answer those as we go along as well. So just a couple more cases of just more anti-aging with those 3 treatments up front. Any commentary on this before and after photo? This is from the organic esthetician.
So you always have to be, when you're looking at these pictures, you know, if it looks like a miracle, it could just be the lighting. So, but here, I think what you're seeing, and so it's clear she hadn't just gone to get a facelift, but what you're seeing is definitely an improvement in the depth of the wrinkle. So I think if the lighting was a little bit different, you'd still see a little bit more of the depth. But the brown spot, everything is really, even with just 3 treatments. And if you look at her jawline and see that's a little bit tighter, and that's something that doesn't really is not affected by the lighting. And it's really fascinating because I saw this with a skin booster that Galderma never proceeded to investigate here in the States. But they show that if you treated, it's for us, it's Restylane Silk. And then in Europe, they call it, I think, just the Restylane Booster, or Skin Booster. They call it Skin Booster. And so what was fascinating was they injected it all over the cheek, and then you could see an improvement in the jawline. And that's basically not because you're putting so much filler in that it's going to lift the skin, but because you're stimulating all of these cytokines. So, you know, so that's pretty good for just 3 treatments every other day.
Yeah, no device or anything like that. This is just
and then
one.
And this, in a way, this shows exactly what I was talking about when I treated all these women in Cabo. Is look at the quality of her skin in the before and after. Now, those are very comparable. That's very comparable lighting. And you can see as the skin becomes more hydrated, you can see that C that's around her eye, her lateral brow under the top of her cheekbone, the light reflection there. That's a direct response to the treatment. And also the pigmentation looks better. It almost looks like she's wearing makeup. Except that light reflection tells you she's not wearing makeup, but her skin is so much improved. I'm not sure how many treatments she had and what the time interval was between these before and afters, but you know, for the acne, like, yeah, it's going to make the acne better too.
Okay, perfect. This was actually a reaction according to the post. So because we get some really great pictures posted on Instagram that we love to share. So this one was from Bowie Aesthetics, talking about a reaction, just redness and swelling due to retinol use.
Yeah, well, retinol can give you a dermatitis. So it can give you inflammation of the skin, but it will still help, obviously, to lighten up the brown here in this, looks like patchy melasma more than PIH. And so it's just really nice to apply it. You can use it after retinol. It's going to reduce inflammation. So any redness and swelling, what are they? They're inflammation. So whatever we're doing, we want to reduce inflammation.
Great, perfect. And then talk to us about your skin of color patients, your Fitzpatrick's 4, 5, 6. How is this working for them?
So this is ideal for skin of color because skin of color tends to be much more sensitive, especially with the darker skin types, like a type 6. And it tends to be much more sensitive to anything you put on it. And so since we're not putting on an acid and we're not putting on, we're not doing some kind of invasive laser, but just applying the mask itself, because of the reduction in inflammation, and remember that hyperpigmentation is a result of inflammation, that she lightened up. Her skin tone evened out quite dramatically, and her acne improved as well. So the causes of the hyperpigmentation were acne, probably mostly acne. And so you clear up the acne. I don't know if she used a topical prescription or over the counter for acne at the same time, but using the mask is a really nice companion piece to treating acne.
Yeah. And Lana, there was a question on just the protocol. How long do results last? And, what's typically recommended? Do you want to comment on that?
Can you hear me now? Yes. After one treatment, if they just do one, it's probably 5 to 7 days. They need to do a series. And before we used to talk about 3, but really 6 treatments and then once a month to maintain.
Mm-hmm.
A minimum once a month. I mean, I personally do every 2 weeks.
Mhm. Just kind of depending on severity and what you're looking to treat or to help improve.
Yes.
Okay, so I know a lot of people have been starting to ask about post treatment. So this is one of your colleagues, Dr. Shamban, Dr. Sadik in New York City had done this paper that was published in the JDD following a RF microneedling treatment. So so I know we have a couple of different results.
Wait, good, yeah.
Yeah, all
Stay
post
here. Stay at
treatment.
this
So
one.
yeah, we'll stay
Mhm.
here. Cool, great.
Yeah. So this was just published, right? 2023?
It was 21.
2021. Okay. Yeah, I was just looking at the date. Yeah, I was like, yeah, I thought it was a little bit earlier. Okay. So as going back to this question, someone asked this also, when can you apply it following microneedling, following fractional, like a clear and brilliant or a Fraxel, whether it's a Fraxel repair, Fraxel restore, which I'm never sure which word belongs to which, because it seems like they're both restorative. And so, how do you use it in combination with these treatments? So my experience is if they have something where there's a lot of heat delivered into the skin, is you have to cool the skin down before you apply the mask, because the mask is fairly occlusive. And so it's going to trap the heat in there, which we don't want. So it can be cooled, the face can be cooled down with something as simple as some ice packs or something as advanced as a Zimmer, like a cold breeze. So you really want the skin to be cooled down. So probably, what are we saying now? 45 minutes, an hour post laser?
45
Mhm.
to 60.
Yeah, about 45, 60. So if you have room to have your patient hang out, then you can apply it there, or the patient can take it home and mix it up and apply it herself. So what is it going to do? Why have the expense? Well, it's actually going to make it significantly quicker healing, and also to absolutely diminish the side effects of swelling, redness, and overall irritation. So what you can see here is improvement in so many of the different attributes that we typically measure of skin quality. So smoothness, redness, pore size, skin brightness, luminosity, radiance, edema, swelling, pigmentation, photo damage. So you can really see that it helps. And as I said, you're not really, the carboxy mask isn't doing all of this on its own, but it's making available to the skin all of the growth factors that are needed.
Yeah. And just after micro needling, so no energy, someone had asked, do you have to remove the PRP? So if you're doing a micro needling plus PRP, would you need to remove the PRP?
Absolutely not. You want the PRP. Those are all even more growth factors. Absolutely not. You want them to get in deeper.
Mm-hmm. Mm-hmm. And so this is a case showing using it immediately after as well. Yeah. And that's what you find. And I love the idea of just being able to apply it to your patients and send them home. It sounds like that's what a lot of your patients are doing right now, because it is 45 minutes in the office. Some people do have the space.
Yeah, we don't have the real estate. We're in Los Angeles. We don't have the real estate. Have everybody hang out.
Yeah.
But this isn't, go ahead. We'll start talking about chemical peels, because there was an interesting question in the chat about this. Go ahead.
Okay. Yeah. So, well, yeah. And I think we kind of started talking a little bit about chemical peels previously as well. So, okay. So this was a question of performing a mild peel, one that doesn't induce a ton of shedding, maybe a light glycolic. Could you do the CO2 lift right after?
So is this patient, well, let's talk about different types of peels for a minute. So this patient whose pictures, these are not my pictures, what's her story? What did she have done? And what's the interval?
This is a VI peel. And so we topped it off. It was topped off at the very end with the CO2 lift.
Okay. So, all right. So it was neutralized and then the CO2 lift was put on. So the middle picture was day what?
That I'm not positive on. It was just mid peel.
Okay. So what's very interesting about using this peel, and it's something to think about. So for many years, my friend and colleague Susie Kilmer, so she's a huge laser specialist up in Sacramento, and so she and we did the class, and she still does the fully ablative CO2 resurfacing. I don't do it so much. We do it fractionated, or we'll do a very light setting with an erbium YAG. But she still does the one that takes off the epidermis all the way to a little bit of the dermis. And she always voted for putting on topical numbing cream, followed and reapplying it, and not just for anesthesia, but also for tissue hydration. So, because there was a question in the chat about like, well, when should you apply the mask? Should you apply it only after the procedure, before the procedure, both? So one thing is you can apply it before the procedure with numbing cream, and it'll make your numbing cream act faster. But it also may do something else, which is you pre-hydrate the skin before you do any of these procedures. So maybe that will diminish healing time, who knows, improve the result. But it's a very interesting idea. There's certainly nothing wrong with doing one of these masks before. And then if you do one before and you don't do it immediately after, I would totally, though, have the patient do a second mask, at least when she or he goes home. But you can see here, and as I said, none of us are sure of her time interval, but how much improvement that she has from the first to the third image here. She's really got a very nice result, and there's thanks to the carboxy mask for that.
And Lana, I think Dr. Goldberg in New Jersey had commented on just peeling, not peeling during your chemical peels, and how the carboxytherapy would affect that. Do you want to comment on that?
Yeah, I think sometimes people are concerned that if they're not peeling, that the peel was not effective.
Well, there's a system called the PRX peel, and nobody peels with that.
So, right, exactly.
Yeah,
well,
nobody peels with that, and you still get a rocking result. So there's a lot of tissue rejuvenation that occurs, and you don't necessarily have to have a peel.
Exactly. And I found that to be the same. I did a chemical peel, and my face was darker. 4 days later, my face lightened up, and I did not peel at all. But because my skin, I use a CO2Lift, which I think most people would prefer not to have the shedding and the downtime and still get the results.
Yeah. So here you can see this is an older patient, and as I just was discussing, that she was both pre-treated and post-treated with the Morpheus system of the RF microneedling. And she got that's a really good result there. That's a really good result. Very nice.
Just pre-treating. This is just with
she didn't have it on after? It was just pre.
She had it both, but this just calling out, this is just the before and after, just with the pre-treating of the skin prior to the Morpheus. So I want to talk through just, your thoughts on putting it on top of the lidocaine. Would you do it before? Would you do it after if you had a choice? And why you would do it on top of the lidocaine?
Well, that's if someone doesn't have enough time to sit there, which they typically don't. You're going to get better anesthesia. And then, and then we would totally do it after. I mean, but no, this patient had it before. Look in her slides, pre-treat, and then after Morpheus 8, she had immediately applied CO2Lift Pro. She had it both times.
Yeah.
Yeah. And a lot of people say that the devices want the water, so to get that skin as hydrated as possible, it can help, maximize the results, or maybe even have I don't know, maybe you've ever seen that you can actually maybe go more aggressive or up your, your settings on.
Well, Susie Kilmer says you can. And yes, the target for a CO2 laser is water. So, yeah. I mean, you certainly need the water in the tissue to do body tightening, tissue tightening. So that's an interesting point, but not really with the RF microneedling. It doesn't make a difference, but the hydration of the skin just does probably start the process. And so I end up with a good result.
Yeah, and I know I've seen you use, I think it was maybe RF on the body. So talking about just, how this doesn't have to be just for the face, right? So it can be used around the body.
Yes, of course.
I see a question on the PRX, and Dr. Shamban just mentioned it. The recommended protocol with PRX is immediately after. It's going to help with any dryness too that some patients may feel by using the PRX.
Yeah, true.
This was a BBL by Cyton and a Silfirm RF microneedling. immediately after on the left, and then doing the CO2 lift immediately after the treatment, and then her result after the 45 minutes. So this was a combo therapy.
Yeah. Okay, very nice. But it's getting close to 6, so let's move.
Yes. So this was just, so I think some people have said, do you wait or do you not wait? And this was my experiences with a hybrid fractionated laser, an erbium YAG, and they didn't cool down my skin. And so it was a little crispy. I still got good results. I felt like the speeding of the healing was still definitely optimized. But just talking through the timing of doing it post some of these deeper heated lasers. And this is after fractionated CO2. We did a split face. This was in Dr. Stephen Diane's office. We did a split face immediately after the CO2. So you want to just talk through just your thoughts on timing post laser, post fractionated?
Well, we talked about it already. We want to wait 45 minutes to let everything cool down. But that's the only thing you want to wait for. It's just the cooling of the skin.
Mm-hmm. Yeah, and we're rushing now, but in DC after that same procedure, Lauren, they used ice packs. Once they cool down the skin with ice packs, they can put it on immediately. If you're not cooling down the skin, it may take 45 minutes, but if you use ice packs, it may happen quicker. So someone was talking about trapping heat. The CO2 lift doesn't trap heat.
Yeah, no, it doesn't trap heat, but if the skin is hot, then you're not able to release it. So, so you've got to let the heat out or cool it down, release the heat, because you don't want it to add too much heat to it, or you don't want to you don't want to trap that heat. So yes, it doesn't exactly trap it, but it has to get released. So, but as you said, the take home message is you either chill the skin immediately with a Zimmer or with ice packs, or you just wait for the skin to cool off. Okay, we're going to talk just a little bit about the vulva and vaginal tissue. So you can see that using the carboxy mask, and this is a wonderful adjunct to vaginal rejuvenation as well. So it's a series of 5 days, and it can really improve the quality of can thicken up the vaginal mucosa. And so it's extremely useful for people that can't have any hormone replacement. But this discussion about the treatment, we're going to talk about just disease in the next slide. But this discussion of this area will be a separate webinar. So we also do know that it has been used very effectively for lichen sclerosis of the vulvar area, which is it's impossible to treat. And so to have some tool like this to be able to treat that area is incredibly powerful. So you can see that the atrophic epithelium is dramatically improved. It's much happier after being treated over a series of time. And so at least we know that if you have this condition on the vulva, or if you have a diabetic ulcer, there's hope for you that doesn't involve something invasive and painful. All right, next slide, please.
It's another case of with the diagnosed lichen sclerosis. So thank you for reviewing that. Much appreciated. And I think that actually wraps it up. So hopefully we didn't go too far over, and we definitely do appreciate your time, Dr. Shamban. I was just going to end this with a little bit of a preview to our part 2 segment, which is going to be with Dr. Alfredo Hoyos. But before that, just any parting thoughts from either you, Lana, or Dr. Shamban?
I think Dr. Shamban does it all.
For me, I mean, it's really fascinating. So I have anybody who knows me knows that I have a number of different providers in my office and estheticians as well. And so, I mean, I see them coming to get it. And so it's not just me who am not just standing out there alone, noticing how effective this treatment is. So it's really exciting to be able to have something that's simple and as straightforward and easy to use that really does so much. So that's my sort of parting thought. Topical hyperbaric oxygen.
Yes. And just one thing too, just the versatility. I think that was our challenge when we just started. What do we focus on? Because it's helping with standalones, helping with, this sort of disease state skin. It's helping with pre and post. So it's just, I think, a great thing in your toolbox, because you can use it for so many different things effectively.
I agree.
Awesome. Well, guys, thank you very much for joining us. I'm going to just end with this quick 3-minute video and kind of teeing up our next webinar. I'm Lauren Dudek. I am part of our team here. You can always email me with any questions, Lauren@CO2Lift. And of course, please go follow, if you don't already, which you'd be kind of crazy if you didn't, Dr. Ava Says on Instagram. I love your content, Dr. Shamban. It's just fun.
Very
It's
lifestyle. Yeah, it's
very lifestyle, very educational. I love the farmers market pieces. It's really great content. So, and then of course her practice Instagram as well. So thank you, Lana, for bringing this amazing technology to us. I mean, even as I was going through and putting this deck together, it's incredible to see the results and how life-changing it can be for people. And I think that that's being felt by a lot of different accounts and a lot of different people right now. So thank you so much. And so here's just a little preview to our webinar that's going to be on November 29th. So we'll send out the invite to everyone. So we'll be sending out this recording, and then we'll be sending out the invite to register for the part 2. And with that, we hope you have a great night. And I will go ahead and play this little clip with Dr. Hoyos, who is being interviewed by Zen Sams on iHeartRadio. Thanks, everybody.
Thank you, Lauren.
Thanks.
So comparing CO2 lift to a hyperbaric oxygen chamber suggests that there may be some similarities on how both treatments incorporate the use of oxygen. Now, you are familiar with CO2 lift, and it has been compared to this hyperbaric oxygen chamber. Can you speak to this in your own experience with patients, and what results and outcomes have you found?
So usually our main concern after surgery, specifically, for instance, when we have flap surgeries, like say a tummy tuck or in a facelift, we have to raise the skin and we have to raise what we call a flap. This flap has to endure some diminishing of the O2 levels, so meaning that we have less vascularization of these areas. Specifically in liposuction, we do secondary liposuctions. We cannot ensure the vascularization as well. So to treat that and to prevent necrosis, we actually have these two powerful tools. One is the hyperbaric chamber. The hyperbaric is very efficient. They actually comprise not only 100% oxygen, but we raise also the pressure. The idea is to raise it to 1.8 atmospheres, so it's 2 times the level of pressure that we have of oxygen normally. That actually compresses the oxygen and makes it literally to go all the way into the tissues, even the tissues that have less vascularization. Provided that, the thing is very difficult to have access to it. It's a very expensive device. It has to be in expert hands, and also it has to be in a specific areas. Sometimes they don't have public ones. Sometimes they have to go to a military hyperbaric chamber. So it depends on the availability that the surgeon has in a specific regions and in a specific city. The CO2 lift is literally what we call a topical. So actually you put it over the skin. And it's a combination of products that actually release CO2 into the skin. The variability is that we usually do that, but we have to inject it. You have to go through a needle, go through the skin, and inject the CO2. The CO2, what it does, it creates a vasodilation. We actually create a revascularization, and we generate more blood vessels. That's the key of providing the CO2. So when I run into this product, I say, okay, what you have in hands is gold here, because it's not only for cosmetic purposes. When I found that they were only use it for cosmetic purposes, just for doing the neovascularization of the skin and doing rejuvenation of the skin. But the main point here is that it can provide through the skin, without having to puncture the skin, the same CO2 levels in higher doses, and even for a higher periods of time than even the injection. So with that, we can have a very powerful tool to induce vascularization in the areas that we have, to spare these flaps, and we have it in a safer, more efficient way with very easy availability as well.
Okay, so there you have it, a little preview to our part 2. Super exciting. I remember when we met Dr. Hoyos, he understood the concept of it, and he just kind of took it and ran with it. So super excited to see his actual results and see him present his cases. So again, thank you, everybody. Parting words, Lana, anything else?
You did a great job, Lauren. Thank you so much. And thank you all for attending. And for those of you who have not tried the CO2 lift, definitely reach out to us. We can provide a demo for you and for you to get started. So again, thank you. Thank you, Lauren. And thank you, Dr. Shamban.
Absolutely. Thank you, Dr. Shamban. Thank you, Lana. Have a great night, everybody.
Take care.
Bye-bye.
Bye-bye.